As everyone knows, medical students and residents must often deal with long shifts that would challenge the stamina of anyone. Surgical resident Dr. Elizabeth Berg allowed us to follow her throughout an evening and night shift.
Room 3 and room 9 are the two big general surgery rooms.
How many ORs are there here?
Like 14, I believe.
Oh, I see. Okay.
Yeah. So it is 10:50-ish or so at night. I am the senior resident right now in the acute care surgery service at St. Boniface, which means that when patients have a surgical issue after hours that their surgeon or their hospital can't handle, it goes to one of 3 places in Winnipeg, whether that's the Grace Hospital Health Sciences Center or here. In our case, we have a patient who came from one of the community hospitals who was found to have a perforation of some part of her bowel, and that's a bad thing. The stuff that your stomach produces and that your gut produces should stay inside and come out at the end. And so if you get a hole somewhere, that can mean really bad infection if it's left for too long.
This surgery is going to take place in the next hour or so, and it's a fairly lengthy procedure, I gather.
Partly depending on what we find, but likely we won't be out of the operating room in under 3 hours from the surgical point of view. From the complete point of view of putting the patient to sleep and waking them up, probably looking at closer to 5 hours when all is said and done. So this is the pre-operative area, so a place to leave their belongings, a hospital gown, the operating room specifically that they're going into, and then they're all sort of set up to come in and get ready for surgery.
So most of these are for day surgeries that are pre-planned and scheduled?
These are for pre-booked, yes.
St. Boniface is a teaching hospital. As a surgical resident, Dr. Berg will perform much of the procedure under the supervision of a senior surgeon.
The surgeon is always absolutely in charge, whether that is on the ward or in the operating room. What happens as we go through training is once they know that you're competent in some of the smaller tasks, you start to become in charge or the first person to do the larger tasks. A lot of us have a very good sense, I think, of the residents that I've worked with, of what we know we can and cannot do. And I am always willing to tell the attending when I'm not comfortable doing something.
All of the residents agree that they appreciate patients who understand the need for a teaching hospital and for the practical learning that takes place on real-life patients.
It's very important from numerous points of view, not the least of which is that in Canada, if we want our healthcare system to continue to be sustainable, we have to be able to train doctors and nurses. And in order to train, you actually have to see things.
So you're back.
Yes, about 5 hours later, we figured. So it's now just after 5 in the morning. And the last time I slept was 24 hours ago.
Really, and so this is the life of a resident.
Yes.
And how did things go in there?
It went well. It was definitely a little bit longer than expected. We spent the last 4.5 hours in an operating theater just down the hall from here with a patient who was quite sick and definitely needed an emergency operation in the middle of the night. Today I feel okay at the moment, partly because it's been about 8 days, I think, maybe 10 days since the last time I did 24 hours. The month before, I had one stretch where I did 7 in a row. So for 14 days straight, every other day, I was in hospital for anywhere from 26 to 30 hours. You develop a little bit of resistance to it on one sense. You sort of learn how to cope. You learn sort of tricks that allow you to function better. So, you know, for instance, in the evening, I'll try to most call shifts somewhere between 9 and midnight. I'll wash my face, brush my teeth, put on dry socks and new shoes for the night because I can't wear the same pair of shoes for 24 hours. That just drives me crazy. Some people will bring stuff and there's showers available in the operating room. So they'll come and at 5 in the morning before we start rounding in the day, they'll come and have a shower and put on clean scrub clothes and then come up. And you just sort of find ways to adapt to it and make yourself feel a little bit more human, I suppose. These are my favorite doors. I want to do this every time I walk by them. Because they just open.
I should think you have enough of a feeling of power being a surgeon.
No, I'm a resident. There's a very distinct difference between having power and not.
And this is your traditional after surgery activity or action. You put on a warm blanket and cuddle in.
Yes. So one of the perks to working in the OR is they have these big stainless steel appliances that look like fridges, except they don't cool the blankets, they warm the blankets. And so in the middle of the night when you're quite cold, as most of us are, especially if you're awake, when you're sleeping you don't notice it, but then you can get a nice warm blanket and settle in and wait for the next patient or the next consult or the next operation to start.
Long, exhausting hours and years of their lives dedicated to education and training. But somehow, something makes it all worthwhile.
So, most of you watching would probably say it's now 5 a.m, you've been there for 24 hours, you still have a little bit of a smile on your face. Do you really like what you're doing? I mean, the answer is pretty simple to me. I love what I do. It was the best decision I made, for sure. Going into surgery, the second best decision I made. I wouldn't change anything. I wouldn't take away the sleepless call nights. I wouldn't take away the tough operating cases. Manitoba is a great place to train. I'm really glad that I'm in the program here. One of my senior residents who just finished this year, so she wrote her board exams, set me up with one of her friends who has become the love of my life. So despite the fact that I work 80 hours a week, which he says is probably the reason why we're still dating, because he has lots of time to do his own thing and I have lots of time to do my own thing. And so I can't complain.